Welcome to the WRAL Daily Download. I'm your host, Ali Ingersoll. Today we'll be talking with WRAL's NC Capitol Bureau Chief Laura Leslie. About 7 weeks ago, North Carolina's Medicaid expansion program rolled out. Thousands of people have signed up since then, and Laura had a chance to sit down and talk with the state's Secretary for Health and Human Services, Cody Kinsley, discuss how that's doing. Now, Laura, you're here to talk about it with us, so thanks so much for joining us today. Really appreciate that.
Thank you.
So what do we know numbers-wise about how Medicaid expansion is going during these first few weeks?
It appears to be going really well. And part of that is because of technology and good preparation. You might remember that during the public health emergency under COVID, a lot of people were on Medicaid that maybe would not have had it otherwise. Well, they already had a lot of those people in the system. So when they rolled off the rolls for Medicaid, they were able to put them back on pretty quickly under expansion. So that gave them like a big head start for enrollment. So about 270 or so thousand people. But at this point, they're up to 314,000. That was as of the middle of January. So they've added 41,000 people that were not in the system at all over the last few weeks. So, I mean, it's one of the fastest Medicaid rollouts. According to Secretary Cody Kinsley, it's one of the fastest Medicaid rollouts in the country.
Wow, that is a lot of people.
Yep.
So what kind of care are people looking for?
Well, so far, it seems, looking at 7 weeks of data, so not a ton, right?
Mm-hmm.
But what they're seeing a lot of right now are, number one, prescriptions. And these are prescriptions for things like heart conditions, blood problems, asthma, things that are real sort of life-threatening issues, that people you can manage pretty easily with medication. And you don't know whether these people have maybe not been able to take it or have been having to pay for it out of pocket. But at any rate, they've seen 150,000 prescriptions filled just in that new enrollment population. There's also a lot of demand for dental care. You might not realize, but Medicaid also covers comprehensive dental care as well as medical. And they've seen about $2 million in claims from that new population just in the last 6 or 7 weeks.
Wow. Yeah, I think the medication thing is really interesting because, like the question you brought up, what have people been doing otherwise?
Yeah, I think that depends on the person. Some people do, they pick between food and prescriptions,
Yeah.
so yeah.
Definitely. So when you talked with Cody Kinsley, the state secretary of Health and Human Services, was he surprised about any of these numbers or anything that we're hearing?
He was not, because they had already figured out that they could use their system to already sort of automatically enroll a chunk of people. I think he's pretty pleased with the 41,000 already, though. I mean, especially over the holidays, that's pretty good. Because you think about how many days off the state had, over that amount of time. Sure. But so he was pleased to see those numbers and pleased to see that people are quickly getting care, not just coverage. So people are already turning around and using it, which is what they really want to see.
Yeah, and I guess that goes to say more about how necessary this was in the state if people are getting this immediately and then going out, getting prescriptions filled, going to a dentist, something like that.
Right away,
Yeah.
right away. Yeah, this is obviously care that they've been putting off or having to find other ways to pay for.
Yeah, definitely. This was a story that was only on WRAL, so props to you for getting this opportunity, sitting down with Secretary Kinsley. You're the only journalist who did that for this one-on-one. Why exactly did you want to have this opportunity to sit down with him and check in with him about the expansion?
Well, I mean, we've been talking about this for 10 years, right? I mean, and so we finally had it happen. And we had it happen December 1st, and there've been a lot of coverage about it. But, the question is always, especially when it comes to a large government bureaucracy, how quickly can it really get things up and running? And in the past, we have seen DHHS have some stumbles over some of it, for example, like new software systems and things like that. In this case, that does not seem to have happened. I also wanted to know, what are people using and where are those people? And that's one of the things I think is really important. There's a new dashboard that DHHS has put up to show you how Medicaid expansion is going. And you can just find it on the DHHS website, but it shows you where people are signing up. And you would not have the really amazing impacts already in some of the state's poorest counties. For example, in Robeson County, 11.9% of the total adult population of that county is now eligible under expansion.
Wow.
We're talking 10.9, and these are people who are already added to the rolls. There may be more eligible people out there, but these are counties where, wages are low. A lot of jobs don't offer health care, or at least not affordable health insurance, and so these are people who would not have qualified under the old threshold, but who do qualify under that new threshold, and they are getting signed up for sure.
And it's amazing that they put this dashboard up there so you or I or really anyone can go and look at this and understand how people are being affected by this.
Exactly. And where it's making a big difference. I think, from the get-go, Kinsley had said that this was going to have the biggest impact in rural areas, but I think a lot of people didn't necessarily believe that because the rural areas only account for about 25% of our state's population, right? Mm-hmm. But it has an outsized impact there just because of the fact that, that we have such a difference in wealth between the rural areas and the urban and rural areas.
Yeah, definitely. Was there anything else that Secretary Kinsley said that about expansion that you found interesting or that you wanted to share with us?
I think that one of the big challenges, he says, that they're facing is, a couple of them are reimbursement rates. Number one, the dental reimbursement rate and the primary care reimbursement rate simply aren't really covering what it costs providers to provide those services, right? So, that's sort of a disincentive for a provider to make room for a Medicaid patient, in their roster. What they want to try to do is to try to raise those rates to make them more competitive so that there's a good reason for doctors to take those patients now. That's something that we saw them do with behavioral health this past year, and it has made a difference in terms of getting more capacity into the system. Another thing he said is kind of a problem is, we've been talking a lot about, are we going to see bottlenecks with providers, right? Because you dump a whole bunch of people into the system, mm-hmm. And you've all got to find somewhere to go to the doctor. Well, he hasn't seen it yet, although he says that may come down the road. But what he's really concerned about is recruiting and retaining the workforce, not just doctors and nurses, but things like, for example, direct care workers, right? Those are the workers that come into your house and take care of your grandma, mm-hmm. or that go into facilities and take care of the disabled and the elderly. Right now, those workers can make more money at Bojangles than they make doing hard physical labor, that they do. And so he said, that has to change if we're really going to be able to sustain the kind of direct care workforce that we're going to need under Medicaid expansion.
That's really interesting. Something I didn't even think of about this expansion. So we're going to take a break and we'll come back. Welcome back. So, Laura, let's rewind just a little bit. We're talking about Medicaid expansion now and how thousands of people have been impacted by the rollout. But can you talk about why this is a story for us here in North Carolina in 2024 when, as you mentioned, we've been talking about this for a decade, right? So we are far behind other states. So what exactly is the story?
Well, we are about the 10th last state to do this. And I still remember I was covering this place when it became available. A lot of states jumped right on it. But North Carolina, which was under sort of newish Republican leadership at the time, said that they were concerned that what would happen is that the federal government would pull the plug on this program. And then they would end up having to foot the entire cost of it. Because right now, the federal government covers 90% of the cost. So, this is millions of dollars flowing into billions, actually, annually flowing into the state in federal funds, right? So they were concerned it was going to be cut off, they said, and they didn't know what it was going to do to the budget. And so they waited and watched and waited and watched. Well, in the meantime, you saw red state after red state after red state expanding Medicaid because fiscally it is responsible. It brings in a whole bunch of federal money and it helps to shore up your hospital system and your healthcare system. If you get a whole bunch of people out there who are uninsured, then those hospitals and healthcare clinics have to eat that expense. And that's why you end up with closing hospitals in rural areas. So, they started to see this. And I think they started to get more pressure over the years from rural lawmakers who saw this as a real problem in their own communities and started to sort of say, well, maybe we should look at this. So they danced around it for a few years. But then finally, what really kind of changed it is that back, I think it was 2022, I believe, or maybe it was early 2023, Senate Leader Phil Berger, who had been adamantly opposed to Medicaid expansion for these many years, suddenly just had an epiphany and decided he was in favor of it. And that's pretty much all it took to make it happen. Now, it was the topic of some serious political maneuvering last year because the lawmakers basically made expansion contingent on the budget to allow them to get things into the budget that otherwise the governor probably would not have agreed with. But the governor was happy to agree with it to get Medicaid expansion. So that's how we ended up here.
Okay. And since we are one of these last states, we have census data that looks at how many people were lacking coverage. It's about 9% of the state's population reported that they didn't have health care coverage during the last community survey, which is a good amount of people here for our state. So a lot of people then that means they have insurance, so they don't really understand what happens if you don't. So can you just kind of touch on what it means if someone doesn't have insurance and why this expansion is so critical to so many people?
Sure. And to preface this, you say 9% of the state's population didn't have healthcare coverage. That's actually a big improvement over like 2010, because it used to be more like 13, 14. So I'm guessing a lot of these folks either have gotten jobs that have insurance, or they've been able to get coverage on the ACA website, the marketplace, right? Obamacare. However, the problem with Obamacare, well, it's not a problem, but Obamacare was designed anticipating that states were going to expand Medicaid. So basically you had to make a certain amount of money to qualify for assistance, because they assumed that if you made less than that, you were already going to be covered, right? Because your state was going to expand Medicaid. Well, a lot of states didn't expand Medicaid. So you had what was called the gap. So you had people who were making just too much to qualify for Medicaid and not quite enough to qualify for help. So they would have to pay full price for Obamacare. So that left them in a hole, because these are exactly the people who could not afford to pay full price for this stuff, right? And that's really important when it comes to, obviously personal health, but also the state's fiscal health. Because you think about, you take high blood pressure medication, right? That's like $1, for a month maybe. But you have somebody come into the ER with a stroke and no insurance. That is a huge amount of money.
Yeah.
Right. And it's that is really the difference, that preventive care. The ability to catch things early, for example, to manage diabetes rather than have somebody have an amputation and have to go into assisted care. It really allows the state to reduce what it's going to have to spend down the road on some of these acute medical conditions by helping them to manage them better out front.
Yeah, and like you were saying earlier, like for some people, sometimes they have to make that choice if they're going to get medical care or if they're going to get food, if they're going to get medical care or pay their rent.
Right. I interviewed a guy one time who told me he was having to pay $500 out of pocket for his prescriptions for his heart, and he was only making $1,200 a month on disability.
Wow.
That's a huge chunk. And he is one of the folks who is now covered, so he can now get these for like $2.
That's making all the difference in his life, I'm sure.
Yeah.
And so there were obviously a lot of political challenges to get this implemented. You kind of talked about this earlier, that we were pretty well set up for this, but have we heard of any issues with this rollout or any roadblocks people are facing?
So far, no. It appears to be going really smoothly. One thing that Secretary Kinsley mentioned is that, there are probably people there. We know there's people out there who applied in the past and who were told they were not eligible, and who might not understand that the eligibility criteria have changed. So they're trying very hard to reach those people. And, those people can be the hardest ones to reach. And you pointed out, if you're taking care of kids, you're taking care of your aging parents, and maybe you've got 2 jobs and your car just quit working. The last thing you have time to do is worry about Medicaid expansion, right? That's not at the top of your list today. But they really do want to get the word out. So they're working with, for example, faith leaders, right, in churches, or community groups that, people might be connected to otherwise, to try to get word out from what they call trusted leaders, people who have credibility in their community, to let people know that they should go and try to do this and get signed up. One other thing I think is pretty cool, this is a great idea, is that they now have the hospitals set up. So if you end up in there with an acute issue, let's say, and you are not covered, they are going to find out if you're covered. And if you're not, and if you're eligible, they will help you apply. Because it is in the hospital's interest for you to be covered, because they get reimbursed, and it's in your interest as well. So, they are really trying to pull out all the stops in terms of making sure that at the point where people need the care is the point where they're checking to see whether or not you'd be eligible.
Yeah, that sounds really proactive that they're doing this. And I think the faith leaders, we saw a lot of success with that during COVID. So it's interesting that this is coming after COVID, because they probably learned this during the pandemic. So moving forward, what can we expect? How many more people might sign up, or what will healthcare look like across the state?
Well, it's probably going to be, there may be some difficulties getting in to see providers for a little bit because you got about 1 million people who didn't have coverage, who may now have some coverage. And those folks are going to need to find providers, and it's going to take a little bit of time for the market to balance itself out, right? Because if you've got nobody who can pay for healthcare services in a county, then you're not going to have providers for that, But otherwise, they estimated that as many as 600 to 650,000 people might be eligible. It looks like they've captured about not quite half of that yet. So you can expect that this will continue to go on. There's going to be a paid media campaign coming up, I expect, to try to get the word out to folks and get people signed up, and again, I mean, this is for people's best, for their benefit, but it's also for the benefit of the healthcare system because it means money that comes in to reimburse that can be used to pay nurses, to pay for tests, to lower rates for other people. So they really are trying to get this done.
Well, thank you so much, Laura, for talking with us today and sharing all of this. And thank you for listening to the WRAL Daily Download. If you've listened to this podcast on WRAL.com or the WRAL News app, you can also find it on Apple Podcasts, Spotify, or anywhere that you listen to podcasts. Follow the show so you don't miss another episode. Thanks for listening.